Hi, my name is David Emerson. I'm a long-term multiple myeloma survivor and myeloma cancer coach. Welcome to the vlog post regarding imaging, the diagnostic technology of imaging studies and the myeloma patient. First and foremost, imaging has come a long way in the past 20 years. It used to be just conventional x-rays were the standard. Now, imaging techniques have gotten much more elaborate and in fact are beneficial for the myeloma patient. It's important to know that as myeloma patients, we will be, in theory, getting imaging studies done for the rest of our lives. It doesn't have to be taxing. It's not a problem necessarily. Do your homework. Part of the reason for this post is discussing insurance coverage, finances, those kinds of things. So here we go. The basic methodologies, x-rays of course, which can be beneficial, inexpensive, quick, pretty easy. CT scans, important, but some radiation comes along with conventional computed tomography, CT scans. MRI is probably the most prevalent. Important warning: when you hear the term MRI with contrast, the common contrast agent called gadolinium has been shown to spur multiple myeloma. Further, it is not, gadolinium is not expelled from kidneys. If you have kidney damage as a myeloma patient, if your creatinine, BUN, are out of the range, think seriously about asking your oncologist not to add the contrast agent. So, X-ray, CT scans, MRI scans, PET, positron emission testing can be extremely important, can be extremely beneficial. All to say, all can be beneficial for you. Confirm with your insurance that it's covered, that it's paid for, because some bone testing can be quite expensive. It's the kind of thing where on initial diagnosis, perhaps you might go to the time and trouble of elaborate, expensive bone testing, but you might take a vacation for a while, for a year or two, have more testing. Or if you go into remission, you might not need elaborate testing. I'm throwing a lot at you. If you have questions, comments, scroll down the page, send me a question or a comment. I'll answer them to the best of my ability. Some of it's local, some of it's based on what your oncologist thinks, recommendations, those kinds of things. So, to summarize, imaging is critical for those of us with a cancer that is in our bones that causes bone damage. Virtually all of us will experience bone damage at some point in our lives as myeloma patients. So get comfortable with bone imaging. But learn the different kinds of imaging, how they apply to you, what's paid for, what's not. It's in your best interest long term. If you have any questions, don't hesitate to ask me, to email me. In the meantime, be well, and thank you for your time.